that in a minute, but the plan was made to adopt a public health approach to the reduction of gun violence in the community. So in the spring of 2019, so while Jack and I are working together, I was given the opportunity to participate in the Community Leaders Institute, which was put on by the Center for Clinical and Translational Science and Training. That's long. I can never remember the full name. It's referred to as CCTST. And this is a collaboration of the University of Cincinnati, Children's Hospital, and the Veterans Administration. The point is to train nonprofit leaders in the community to engage in public health research. And so that's the background of the research that I'm going to present today. So Alice, if you could take us to the next presentation. Thank you. So in order to fulfill the credentials of that training, I was asked, along with the others in the training, to design and execute a research project. Some of the other projects had to do with city gardening, child health care. So a lot of different topics, but this was the one that we brought to the table. Let's see if we can advance to the second slide. Thanks. Can that be enlarged, Alice? Okay, that's fine. I'm not sure what it appears like to others. It's looking a little small to me.
It's very easy to read.
Okay, if everyone else can see it, fine. As I said, the research was proposed in the spring of 2019. The data collection was started in the fall of 2019 and completed in the winter of 2022, so just recently. What that means is that I actually just wrote this and submitted it on Friday. So it's very new as we present it today. But since the time that this research was proposed, 220 people have died as a result of gun violence. And also importantly, in the last year, 12 juveniles were charged with murder as shooters in an incident. As mentioned, the new mayor, Aftab Preval, in January of this year declared that gun violence is a public health crisis and a leading cause of premature death. And unfortunately, Alice, I actually myself cannot see the full slide at this point. Thank you, thank you. And so therefore, what we are looking for are informed decisions. And the work that we're doing in a public health approach is provide evidence that can inform those decisions to come up with measures to address the leading cause of death among many of our citizens. So let me first give you a background of this research. So if we could move to the second slide, thanks. What we see here is the mission statement of the Gun Violence Prevention Working Group. And as I said, I refer to it as a working group as opposed to a ministry, because as we take it into the community, I don't want anyone to think that we are coming to them with an answer or we're coming to them with something that's meant to convert them, that actually we are working with them. We are coming to them with our feet and our hands and our voices to join in the work that they are doing. So the mission of the group is to identify and address the full needs of a Cincinnati neighborhood and coordinate efforts to address the causes of gun violence there. We will identify the demographics and characteristics of the people who live in the community, the needs of those community members, and the challenges those community members face. And then we will utilize available resources to help members of that community implement research-based methods to prevent gun violence. And after forming this mission statement in collaboration with the Cincinnati Police and with the community outreach advocates and others who are working in gun violence in the city of Cincinnati, our group determined that we should focus on the Price Hill neighborhoods, Lower East and West. In actuality, most of our work these days is taking place in Lower and East Price Hill. So if we could go to the next slide. I'm going to quickly go over this. This is in fulfillment of the requirements. We identified the milestones that we anticipated in going forward with our projects. So the first one, in collaboration with key leaders and organizations, I feel that we've already made giant strides in that. It's ongoing, the conversations that we have, but primarily we have worked on fulfilling that. So Jack and I can talk later about the listening tour that we have taken through the Price Hill neighborhoods. Milestone 2 is really where this research is focused. And it's started, as I said, with that listening tour. The current focus is supporting those existing organizations that are addressing the factors that contribute to gun violence, and to finding out what the missing resources are so that we can help them to fill in those needs. So we can go on to the next slide. Not going to spend a whole lot of time here, just to say the circled areas. We talked about activators and inhibitors. Activators you might all recognize as cons, assets, things we already have on our side. Inhibitors are the cons, the things that are potentially obstacles to us. What I identified was our lack of knowledge and connection in the neighborhoods, and primarily missing feedback from residents on the street. So not just leaders who we have been talking to, but the people who actually are being affected on a daily basis. And we can go on to the next slide.
And I think it's important to point out that it isn't that Price Hill doesn't know what's going on. It's that we didn't know what was going on. And it was our work and Judith's work to go in and ask questions to inform ourselves. Because there was, in every neighborhood we looked at, there was work going on. There were people doing the work to try and reduce gun violence or taking steps that should lead to the reduction of gun violence. We just didn't know what they were.
Mm-hmm. Okay. And Jack, thank you for filling that in, because I think that is an important point in the public health approach, is that we went in not with any answers, but simply asking the questions and indicating that we were there to provide support for the work that was already going on, and that we were there to listen to find out where more work needed to be done. So again, this is very research oriented, but it goes over the purpose of the research, and that was to focus on teens and young adults in the Price Hill neighborhoods regarding their experience with gun violence, the impact it has on their daily lives, and the initiatives that they thought were worthwhile in pursuing. The design was to interview residents who were 12 to 30 years of age. So that's what I was identifying as teens and young adults. The plan was to use cultural brokers. And by that, what I mean is people who already work in the neighborhood, already have a knowledge of the neighborhood, and established relationships with the people that we wanted to interview. So they already know these teens and young adults. And as I'll talk about later, it's essential that they have a very deep level of trust with the people that we're interviewing. At this point, we were able to offer a gratuity to the brokers who not only recruited, but scheduled and conducted the interviews. And I was present for the interviews themselves, and I took notes during the interviews, but I actually relied on the cultural brokers to ask the questions. The respondents received also an incentive of $25 for 30 to 45 minutes of their time at a convenient location for them. So some of these interviews took place in Echo Park, in Washington Park, at the Rec Center in East Price Hill, at space provided by Block Ministry, at McDonald's. So anywhere that it was convenient and comfortable for them to have a conversation. They were all conducted using the same interview guide. And I should specify, this is a qualitative interview, which means that we go in with a structure, we go in with a purpose, but the interview often flows itself. And so while we try to hit all the questions, they may not be asked in the same order, they may not be asked in the same way. And certainly it was very important to let the cultural brokers and the interviewees determine what language was appropriate to use. So we could move on to the next slide. And we'll now get into what happened during the data collection and the results. One of the things that it was important for me to cover is, why did it take so long to interview 18 people? Keep in mind that, first of all, I'm relying on cultural brokers who were willing participants, very involved and interested in this research, but this was not their priority. They had other jobs and other things going on in their lives. So I was relying on them almost on a volunteer basis, even though they were receiving a small gratuity. Probably the major obstacle was COVID-19. So as I mentioned, the data collection started in the fall of 2019. We then ran into essentially a year of no activity. In addition to this, respondents were actually more hesitant to talk than I might have imagined. The trust that they had to put in me, even being present to talk about some of these situations, needed to be high, and therefore the use of the cultural brokers was essential. I also found that some of them backed out of interviews because they were concerned that talking about a situation might appear to be one in which they were snitching on someone, and they didn't want to be the focus of any retaliation. And for others, they simply said, my time is worth more than $25. I also experienced a significant computer crash during this time. And there were some leadership changes in the cathedral itself. Probably the main one that had an impact on me was the retirement of Karen Montano. So I wanted to give a call out to her, the canon missioner. That was very instrumental in the work that we were doing. And I look forward to her replacement coming to us in June to revitalize some of this work. Okay, we can move to the next slide. So in the end, we interviewed 18 teens and young adults. This gives you a sense of their ages, their genders, and the incident that may have qualified them for these interviews. The ages, I was surprised at the end, we had a split evenly between teens and young adults, almost equal split between male and female. And in terms of the incidents, and I'll speak more about that, but 2 of them had lost immediate family members. 4 of them had lost friends. 2 of them had been wounded and actually paralyzed by the experience. 3 were bystanders in which shots were fired, but no one was struck. And 7 of them were residents. And I don't want to downplay that, because these are residents who realize that they are vulnerable to gunfire happening in their area, and witnesses from a distance of the gunfire happening around them. So we can go on to the next slide. Thank you. This is the interview guide. And without going over every single question, there were 4 main topics. We asked about experience with gun violence. And this I collected on a numerical basis at the beginning of the interview, just to get a picture of what have you been exposed to. So how many people do you know that have been shot? How many of those survived? Were any of them members of your family? Tell me about how often gunfire is happening around you. what do you think the frequency is? Then we talked about the perception of presence of guns. How many people carry guns? Where do they get them? The impact of gun violence on their daily lives. What's changed for you? How do you conduct yourself in a way that might be different than prior to having experienced that event? And then finally, and I think most importantly, we asked about what are the things that you think need to happen to address this situation? It's obviously making a change in your life. What would you like to see happen? And who would you like to talk to? And we can go on to the next slide. So the next slides that you'll see have to do with what we learned. One of the important things that I mentioned was how we defined a victim of gun violence. This was my own definition, not what the respondents said, but when I defined it for them, it was very broad. It included knowing someone in your family or your friends who had been shot, either died or survived. If you were a bystander at a shooting, if you had a close family member or friend who was shot. And I even included in this if you knew anyone who was responsible for the shooting, so the perpetrators, because I consider them to also be victims. And then after the first interview, we included anyone they knew who had been threatened with a gun. So with this definition, an overview quickly, the youngest respondent I interviewed had lost both her father and her grandfather to a shooting that occurred in her home. The oldest respondent had recently lost a cousin in a well-publicized shooting in a public place. As I mentioned, we had 2 respondents who had been the victim of gunshots that paralyzed them. And 3 respondents were present at a shooting where no one was struck, thankfully, but all of them were aware of pervasive shootings in their community. As we go on to the next slide. Thank you. And I'm going to go over these fairly quickly so that we can get to the final conclusions. But I think the important thing on this slide is that perceptions can vary. So even among kids in the same neighborhood, they had different perceptions of how frequently gunfire was happening. And younger kids not as perceiving not as much violence as those who were actually on the street and were thinking of it as a daily event. They didn't talk about the perpetrators very much, and certainly that's not surprising. And as I talked about trust and retaliation before, the fact that they didn't want to snitch on anybody. The use of guns with threats, I think for me was not a surprise, but I didn't realize the prevalence of it until I heard them talk about how often someone either talks about having a gun, shows a picture of a gun, or actually pulls out a gun and just shows it. For younger kids, this was seen as kind of cool talk, somebody just trying to increase their credibility. But for older teens and young adults, this actually grew into more of a menacing, I'm showing you this gun because I want you to know that I can hurt you. Can we go on to the next slide? This finding has to do with the perception of the presence of guns, and the respondents clearly delineated between illegal and legal gun possession. But the sad part of this is that because of their perception of illegal gun possession and the sense of their own vulnerability, almost everyone that I spoke to said they either had a gun if they were over 21, or they planned on getting a gun when they turned 21. The places that they knew that guns were available, pawn shops and friends. And they knew that there were restrictions but they frankly didn't feel that other than a felony or perhaps mental health, that there should be any restrictions on who could carry a gun. So we can go on to the next slide. One of the things on this slide that I'll speak to is the idea of holding guns. So they were well aware that illegally guns could be borrowed from friends and relatives. They could do a straw purchase at a pawn shop. There are community guns in which it is known that a gun is available at a specific location, or simply stealing guns is another way that they can be obtained illegally. The thing that we talked about, again, that I found surprising was holding guns, situations in which adults who possess an illegal gun pass it on to a young teen, because they know that the younger teen, if they're caught with the gun, would face juvenile prosecution, whereas the adult probably already has felonies on their record, and they would face more dire consequences. So they have somebody carry it for them. The downside of this carrying guns is that the shootings that we see of the young teens, the 14s and 15-year-olds, is often a consequence of holding that gun for someone else. The driver of this that they all recognize is money connected to drugs and gambling. And the final point on this, it's also noted that finessing or disrespect is also a cause for violence in the community. And I, again, find that's true because there is such low self-esteem. And so anything that is seen to pierce that is cause for violence. So we move on to 16. Thank you. So a large part of what I heard in this research was that guns have become normalized in their lives. And they are aware of how little security and safety that they feel, even with more guns in their community. Certainly those who have lost family members have the most impact on their daily lives. Those whose parents have been paralyzed feel that impact. But there's another impact, which is people in the community feeling cut off from their emotions. So as you see here, the comment, I've gotten used to shootings, not even cried about my cousin. It's common. Getting t-shirts made with a face is a habit. The idea or rule is if someone does something, you got to shoot them. You don't even bat an eye. You're not allowed to have feelings about it. And as another person commented, walking my younger sister, just a guy shooting down the street to test his gun out. I get out and I grabbed her and no one was around. No one even batted an eye. They just went along with their business. We have to pretend it's normal to contend with it. And I think that's a consequence to which we really need to address a lot of our attention. As we go on to slide 17, what they find, what they report is that there are no other ways to de-escalate, that they feel like people just pull out a gun and threaten you, or actually end up shooting someone, perhaps accidentally. So the way that they describe it is being in the wrong place at the wrong time. It's something that they feel is out of their control. And even though they incorporate it into their daily lives, they feel vulnerable every time they're outside because they feel like they might be the victim of a mistake. As they said, I have to check myself, be more aware. Sometimes you're just minding your business when people get shot. So we go on to the next slide, 18. Actually, what I would like to do at this point, because we go through here the initiatives that they discussed, is skip to where we talk in more depth about these initiatives. So we can go to slide, the conclusions. Thank you. And then slide 21. So as I said to Jack this morning, it's one thing to talk about the data that you collected. It's another thing to talk about, well, okay, what do you do? What did we learn from this? The 4 things that I found most important to take from this, that the experience with gun violence has become normative. It's accepted as part of their daily lives. Secondly, that the impact on daily life has become to suppress vulnerability and fear, and to exist with that pervasive lack of safety and loss of control. Third, that illegal guns are seen as easy to acquire, and that holding guns has become a source of violence, either because these kids are the target or because in holding the gun, they end up using it impulsively. I'll tell a story here in which it was related to me that someone had lost a friend who, a young teen, was holding a gun for someone else. While he was holding the gun, he decided to threaten someone with the gun in order to get money. So he was trying to rob them just by showing them, hey, I've got a gun, not realizing that the person who was a stranger to him was also carrying a gun and felt threatened by him and shot in self-defense. And he died as a result of that. So it's not just holding a gun, it's actually giving them the chance to use that gun. Fourth, a consequence of the violent environment is that these teens and young adults felt like it was almost a necessity that they own a gun themselves. They all had access to a gun. They knew somebody that owned a gun, and they will, as they said, they will legally carry, but it is possible in the situations in which they feel threatened, they will potentially illegal carry. So the next page, thank you, is where we get to what I consider to be the most important part of this discussion, the preventive measures that they indicated were important to them. And I reorganized them for the sake of talking about what was important to the community at large versus what was important to the teens and young adults on a more immediate basis. So one of the things that they asked for was a reduction in drug traffic in their community. They knew that the gun violence was being driven by that, and they felt like if you can get the drugs out, then that's going to go a long way to keeping us safer. Also, stability and dignity within their family. They want their families to be safe, and they want other families to be safe because they feel like then they won't be tempted to get into illegal activities to try to make money for housing, and they'll have other ways. They want other ways to earn that money through job opportunities. What they want for themselves, safe spaces, someplace to go when they're not at school. So they do feel comfortable in their schools. That's a rueful laugh on my part, because so often we think about school shootings. These are kids that think about being safe in school. And so what they're looking for is someplace else when school is not in session. Also someplace that has a youth program that can not only give them an activity to get them off the street, but also an activity that can help them prepare for life. Things that they very specifically ask for: mentoring, a positive role model, somebody that could teach them skills and make them feel worthwhile. While fortunately, many of the kids that I talked to had families that cared for them, they still themselves, and they knew of friends who found it hard to find that self-worth within the community, and a mentor can certainly go a long way to that. They also mentioned training in conflict resolution, that if they had some other means of dealing with the conflict that they feel, perhaps they felt that their peers wouldn't rely on violence. even physical activities to work out some of their emotions. Well, it's just a way that they thought would be helpful. And as I mentioned before, skills, paid opportunities that would benefit the community and develop skills for their future. As we go on to the next page, this is one where I'm going out on a limb as the researcher. This is something that the respondents did not articulate themselves, but that my sense is coming out of this research that there needs to be something available to help them help them address their trauma. That while they don't identify it as trauma, those of us looking in from the outside can see that this is traumatic, that many of the things that they describe, the normalization, the lack of feeling, is a result of the trauma, the normalization of the presence of guns in their environment. And in fact, the reliance on guns in their environment for security, and their discussion of the lack of basic safety and security, that these are all things that may lead them into high-risk behaviors going forward. So I'm not sure what it is that we're looking for in the community, but something not addressed as mental health, because it's unlikely that they're going to pursue that, or something that you offer talking about trauma services, but some sort of services for them to help them address these mental health issues, probably described as life skills or opportunities that help them move forward, especially, again, as it might come to expunging offenses from their records. We move on. I'm going to just go through the next slide on to the one after that. Let's just say this is procedural. So what are our next steps? As far as the working group, we will continue to make contact with those groups and individuals in the community who we have identified and we have been supporting. We'll look for new opportunities, and especially look for new opportunities that address the needs that have come out of these discussions. There has also been a plan that has been discussed with the new Dean, Owen Thompson, about a forum in Cincinnati to discuss these programs, the importance of these programs, and the way in which the people in the community who are most effective had asked for the programs that I just covered with you. And then finally, a means to communicate those results to decision makers in city government so that we can be informed based on what our teens and young adults are asking for to reduce gun violence. And at this point, I'll stop. So if you want to take it back to the front, the very first slide, we'll stop there for a moment.
There was a question in the chat, Judith, and maybe you can answer it. If you came up with any situation where you learned about a crime that wasn't reported. Ed asked, were all of the shootings reported? Did you come across in your interviews? So in your case, like every shooting that was being reported to you had been reported to authorities as well.
Right. Yeah.
I see Nancy has a hand up. Nancy, are you able to ask your question? Either type it in the chat or ask it out loud.
Here we go.
Okay.
Yes, this is Nancy Sullivan. Ed and Bill know me. I'm a member of the Church of Our Savior, La Iglesia de Nuestro Salvador. I live in Price Hill, and the church spun off an independent 501c3 that actually your former dean helped support Transformation CDC. So I work entirely with immigrants or their US born children here in Price Hill, as well as on bigger issues. But we actually formed a group a year and a half ago called BASTA, which means enough, that was formed because so many Hispanic immigrants or their kids had been the victims of violence. And, you know, I know one man who was shot and killed, numerous other people who've been victims of felonious assaults. You know, I've worked with Sergeant Hicks. And so I'm curious to know how you reached out to the Hispanic community.
And I did not specifically reach out to the Hispanic community. The brokers were the ones that gave me contact to the respondents. And so I was relying on them to make that decision. And as it happened, they did not include any Hispanics in that research. I am aware that that community has been victimized disproportionately in the Price Hill neighborhoods.
Right. So, I mean, I'm unlike a lot of people who've kind of been siloed during COVID. I'm out in the streets all the time, and I'm kind of interested that nobody pointed to me as a broker. I have conservatively at least 300 names on 3 different Spanish language WhatsApp groups just in Price Hill.
Mm-hmm.
And
Nancy, we would love to include you and work with you. We did in our preliminary meetings with the cathedral. We worked with Santa Maria, and all we did was follow the links. So I guess we're as curious as you are that your name didn't come up, because one of the things that we continuously asked as we were meeting was who else do we need to know? What else do we need to know? And we just followed all of those links as far as we could. And, you know, so we would love to close that loop with you.
And I mean, I work some with Santa Maria, but I'm the one who accompanies people to the police station to make a report, or who, you know, insists that they get an interpreter. So I would love to work much more closely with you on this. And this may or may not be related, but yesterday morning, I got an email from Brian Gary about a presentation at the Price Hill Rec Center last night. Well, I was driving immigrant kids, so I couldn't go, but it all was about gun violence in the city. Does that overlap with what you're doing?
We encountered Brian. Well, you want to take that, Judith, or you want me?
Well, I was just going to say, and Jack will back me up on this, there are a lot of different small groups working on gun violence. And one of the things I would put on our inhibitor side is trying to make contact with all those groups and determine what the overlap is. So we have had contact with Brian, and I was aware of the meeting last night. I was not able to attend, but have worked at his other meetings, have attended his other meetings, and worked with him on the formulation of the plan that he submitted to City Hall. Okay.
Yeah, and also I worked with him for a while. I was co-chair of Neighborhoods United, which is the umbrella group under which I think he called the meeting last night, and he'd been doing that work. And now he's continued that work independently. So yeah, we're aware that that's going on. It's just one of those, and again, that was what our job was to be present. I think Judith said it really well at the start, just offer our hands and our heart and our time and our effort. And I put my email and my phone number in the chat. Nancy, I encourage you to reach out to me. And we would love to sit down with you and learn how we could be helpful.
And just to say, every Saturday I have an outdoor food pantry in what's called Westmont. If you ever went over there, that's probably 80% immigrant. And you probably don't want to be out there this Saturday when it's 40 degrees, but when it warms up a little, that is a place where you could actually bring some people together. Westmont was especially hit by robberies at gunpoint until Sergeant Hicks really leaned on the management to get better security cameras and such. So I can, you know, it's getting, you indicated that one issue was actually making it worth people's time.
Mhm.
And poor people often don't have a lot of time. So this pantry is a perfect opportunity to a certain extent hear from the other side. And what it's done in this neighborhood is exacerbate fears by immigrants of African Americans, just speaking very bluntly. And I just say, well, you know what? You didn't leave your home country because the narco trafficker or the person trying to extort you was African American. He was somebody who spoke Spanish and looked just like you. So, and then to just jump forward to the trauma reduction, a group of people, including some people here in Price Hill and I, but people with a lot more experience than I in this field, are planning a retreat for unaccompanied minors who've had horrible things happen to them on their way to Price Hill. You know, one young man whose father was murdered by a gang and their house torched, and then his brother was murdered in the street while he was waiting in Mexico. So there are ways to work with people that it's not kind of mental health that could be really, really interesting. And so we can talk about that at another time too.
I would very much like to do that. I also should probably have prefaced this by saying, as a person with an extensive background in research, 18 people is minuscule. I would never usually present that to somebody. I was hoping for 20, maybe 25, 36 even. And so with the right funds, I would like to continue the research that we're doing to add to this sample size.
Excellent. Great. Yeah, I think it would be, I mean, from my perspective, I think people also really want to be heard. There's a kind of cloak of invisibility. So we'll actually be presenting at the neighborhood summit about taking off that invisibility cloak.
Well, and one of the things I think we've done really well in our society is otherize the problem, right? Oh, that's a problem of the poor. That's a problem, speaking as a white person, that's a problem for Black people, or that's a problem for immigrants. And that really breaks down the whole concept of community. And you know, one of the things that I think it's important that the cathedral can do is lend our voice as an established, long-term, productive entity in the community to say, actually, the community is all of us. And you know, your voice is important, and the voice of these individuals you're working with that's our community. So yeah, we're eager to close that loop and meet with you and learn more.
Great, thank you. Sorry to monopolize things here.
No, it's wonderful.
I'm not seeing, if there are questions in chat, I'm not seeing them. So
I don't see any others. I just saw Ed's earlier.
Other questions from folks out there?
Oh, I realize I put my contact information. I didn't put it to everybody.
Oh, Justin Jeffrey has a question. Or a
Hi.
comment.
Several years ago, can you hear me? Okay.
Yes.
So quite a few years back, when I was working with Street Vibes, there was a summit at United Way, and it was the Sandy Hook Promise, and it was part of a mental health, I guess, sort of summit or something. And I went there thinking that it would have something, at least some component having to do with, you know, changing gun laws or something like that. But it was actually just about the latest research on early childhood trauma. I think they refer to it as adverse childhood experiences, and how all the things, you know, whether it's seeing domestic abuse or violence in the neighborhood, or food insecurity, housing insecurity, you know, all these things create trauma and can actually affect the way kids' brains develop, and they can have long-term effects. And they had charts talking about how, you know, it's a lot cheaper and more, productive to help deal with the early childhood trauma. And, there are some ways that they can help to improve the brain development or make it kind of go back to normal development, and the long-term effects of that and the cost of, the likelihood down the line of, just problematic issues, and the likelihood that kids will drop out of high school, will end up in, the criminal justice system. And so I feel like all these issues that we see at the community issues forums, whether it's the need for criminal justice reform, for building trust with our policing, the lack of affordable housing, hunger, all these things are really connected. And I think they all play a big part of why we have this level of violence. And so I guess my question is, are you familiar with the Sandy Hook Promise? And if so, do you plan on maybe, I think they had one of the parents of the children from the Sandy Hook massacre. So I was wondering if you all knew about it and were interested in trying to work with them somehow.
I am familiar with Sandy Hook Promise, and I'm on all their mailing and donor rolls. I'm also, and then where is she? There she is, Jill Bowman.
I saw her too, yeah.
Is an associate of mine in Moms Demand Action and Everytown for Gun Safety, who also provides a lot of information on trauma. And we have had discussions on who in Cincinnati can provide those kinds of services. Jack and I actually had a conversation several months ago with a mental health professional about trauma services. And it's one of those, well, either fortunate or unfortunate. We had the conversation. There wasn't anything we could jump up and do the next day, but it's something that we continuously have in the back of our mind as a priority that we hope to work on. But one of the things that he said that I thought was most informative is, these are not people who are going to say, hey, I've experienced trauma, can I have some mental health services? There's got to be another way that you open that door for them. But yes, I wanted to circle back and say, one of the things about the working group at the Cathedral, I sometimes fear that calling it gun violence prevention is a misnomer. That is what we're concerned about, but the prevention part is dealing with the factors that you mentioned, housing instability and childcare and job opportunities and income inequality and policing, and all those things contribute. So we're following those as well, but with an eye to following those to reduce violence in the community.
And I'd add on to that, and I see your hand, Jan Seymour, you're next in line. When we started working in Price Hill, it was routinely the first or second, it had the first or second most amounts of gun violence every year for years. Now it's either 9th or 10th in terms of gun violence based on, compared to other neighborhoods in Cincinnati. Is that improvement because we were there? No. Is it because there are a lot of different groups involved? Partially. Is it because Sergeant Hicks and the team there have done a very proactive job of listening and responding? Probably. Does it have to do with the expansion of Nehemiah Industries, which has been active in hiring felons and hiring people who might otherwise have trouble getting work in that community? Yes. I mean, it's an all of the above thing. And what we're just trying to do is impact the part of it we can impact. We can't change minimum wage. We can't make Price Hill housing affordable for someone who earns a minimum wage, right? But we can connect some of these people who are doing this work. Jan, what was your question?
Well, the thing I wanted to say is around what Judith was addressing previously about the whole situation. I was in a meeting, I think last week or week before, with a juvenile judge, a juvenile court judge, and they were talking about the issues that they have with the kids coming before them. And one of the things that was pointed out, which I thought was very telling, is that 49% of the kids that were appearing in juvenile court for, some kind of crime, 49% of them had previously been in family court because of abuse or neglect or things that had happened, earlier in their life. And so it's that trauma of kids. And I just wonder, at that point, it seems like that would be a good point to pick these kids up and begin to work with them when they first appear rather than later.
Yeah, I think I keep picturing our work as a big circle. And, there's the gun violence, I think the place to work on that circle is every place. Right. Is it about gun laws? Is it about wages? Is it about trauma as a child? Is it about parenting? And the answer is yeah. Right. Like all of them are the right time to do some sort of intervention. Stacy Smith, who is running for city council, she's frequently on social media talking about the social supports needed by the children that she's interacting with on a daily basis as a counselor. Like, yeah, yes, and.
Yeah, all these issues are so connected. I mean, we've done a lot of work on the affordable housing issue, and that obviously plays a huge role in Cincinnati neighborhoods. One thing that struck me, Judith, about your research was kind of not only the trauma, but the fatalism, that this is the way it is. And that makes it really difficult, it would seem to me, if you reach the point where you say, that's the way it is. I've got to own a gun. I've got to exist this way.
Well, and I think Jack will agree with me as well. And Nancy, I'm sure will too, that one of the things that we found in going into the Price Hill communities, there were already existing groups, obviously there, that were concerned and were working and had great ideas. A great group of people who care about the area that they live in. So it's not that I go into the neighborhood and fear for my safety while I'm there. And it's not that I'm meeting people that I think I have nothing in common with. That's not that at all. These are my neighbors. These are people who have the same concerns that we all do. The issue, and Jack and I talked about Maslow's hierarchy of needs, and I thought, do I need to pull that up? The issue that these kids are dealing with is you got food and shelter as the very first step, and you have safety and security as the second step. And if you're stuck there, how do you move into relationships? How do you move into self-esteem? How do you move into the next levels? You always remain somewhat stuck in that deficit. So, Nancy, did you have another question?
I think she just didn't put her hand back down.
Oh, okay. And it looks like Susan's raising her hand.
I was just going to mention, Jan and I were in a meeting last night, that House Bill 215, if it passes, it means that no one needs a license for a gun.
Oh, good.
21 and over can get a gun. They don't need a license for concealed carry. They can take it anywhere they want. It's a horrible bill presented by Senator Johnson. And it's going on its fourth hearing. It looks like it's going to pass. They listen to all the opposition and they just go ahead and vote for it.
Wow. It's horrible.
Yeah, I was just putting that in chat.
Well, that, and along with Stand Your Ground, I'm not sure what the bill number is anymore. How many times has that come up? And
it did.
Stand Your Ground. Horrible, horrible.
And with Stand Your Ground and this bill, if it passes, anybody's going to be able to say, hey, he threatened me, so I shot him anywhere. Time.
Well, the Smale Park shooting that had the city so on edge, theoretically, this was a conversation Judith and I were having, like, you could ask the question, were they both good guys with guns who, trying to defend someone, shot someone else? or trying to defend themselves and stand their ground shot each other. Is that now what we see as acceptable social behavior? I think not. I think it's terribly disruptive to the order and social structure. But yeah, so the politics is part of it too, right? Thinking of that circle, there needs to be a group, and there is. Moms Demand have been doing a very an amazing job nationally about addressing those issues, and there are other groups working to fight really bad legislation like that.
Well, we're reaching the end of our time. In fact, we're maybe a minute or so over, which is not bad at all. But any final comments from you, Jack or Judith, in terms of we're going on with this theme next, the 10th of March, and we'll have some more on this topic. Obviously, it's tragic and complex and touches so many different phases of life that it's not easy to come to grips with. But we're in our debt to have people like Jack and Judith working so hard on this particular tragedy in our community. So
the only thing I would say before we leave is a plug for, if you're interested, Jack and I would love to have your participation in the Gun Violence Prevention Working Group. And during the warmer parts of the year, there are lots of outdoor, like one-time outdoor activities that we try to publicize so that you can come in and one day work in the Price Hill communities to make things better.
I'm glad you brought that up, because we always, groups like yours always need further volunteers and help. So that's what we're all about here. Anyway, I'd like to thank both Jack Jose and Judith Robinson for their participation and putting this together, and we'll see you in 2 weeks.
Okay, thank you for attending.
Yeah, thank you so much for spending your afternoon with us, or your lunch.
Alice, would you ask if it's okay to share Judith's material?
Sure. Yes, that's fine. I think I credited the CCTST. So since they provided the funding for it, then they deserve the credit.
I'll just put it up on our website with the video. Thank
Okay.
you.
Thank you.
It was very interesting, very interesting. And
right.
Susan, you didn't go with the voter collaborative.
I wanted to hear this. Yeah.
It was good, very good.
Thank you. Thank you so much.
It was
excellent.
great. It was great. And I think the research they've done was just great. I'm so impressed with that group. I just learned about it through this meeting. Very